Full mouth scaling, in a layman's language, is a professional cleaning of teeth by the dentist or in the dental office. What happens is that when we eat, there is a little food that is left on the teeth. Even when you're brushing very well, you cannot be 100% effective. There are some spots you'll not be able to reach. And that means some plaque will build up in those areas. And then calcium deposit, and it hardens, it becomes a bit of tartar. Even the best of the brushes. Within 6 months, there's some areas, blind spots that we are not able to reach properly. And that's where the dentist comes in and helps clean those. We normally recommend these days that everybody should get a full mouth scaling and a polishing or prophylaxis every 6 months. For people who drive, your car needs to be serviced every 5,000 or 8,000 or 10,000 depending on the oil that you're using. You change the oil filter, probably the air cleaner and the fuel filter after some mileage. Not that the car had a mechanical problem, but for the efficient running of that car, we need to remove that oil and change it so that the car can serve us longer and it doesn't go stalling on the highway. The same case. Why do we think that we can use this machine called the mouth for 2, 3, 4 years, 5 years, eating all the stuff we put in there, and that machine does not need service? So I equate full mouth scaling and polishing to the servicing of the car. When I tell my patients that kind of knowledge, I say, oh my goodness, I've not been servicing myself and I've been servicing my car all the time. So then they see the need. And then your mouth remains clean, the breath remains good, you arrest gum disease, there's no bleeding, there's no destruction. That's how people manage to keep their teeth for a lifetime, because you keep the periodontal and the gum disease in check and you keep your teeth to your old age. But in our environment, because we were not socialized to that when we were growing up, people only come, let's say, when they have symptoms. The teeth are hurting, they can't chew, the teeth are wobbling. So that then you find that then my treatment really also becomes very difficult. But if you come every 6 months, it is painless, it takes a short time, and it's easy work for both the patient and also for the doctor.
You're basically saying we shouldn't even be thinking, or how can I tell?
Yes.
Just make it part of your schedule. Every 6 months or every year, I must go and do
exactly. That's what
the cleaning.
Let's do exactly.
Yeah.
I'm here for. We tell our patients, in fact, you are going to see the dentist for a cleaning and a checkup. You, as a patient, you know, my teeth needs to be cleaned. Okay? But as they do the cleaning, they will check. Just in case there's something I am not aware about. I may be grinding my teeth at night. There may be a filling that is broken. There may be a small new cavity. Then if we spot that, we will let you know. But you knew you needed your teeth to be cleaned. Even those patients who come to our practice and they do travel, I normally tell them, if your 6 months lapse when you're out of the country, just look for any dental clinic and get the teeth cleaned. And when you come next time, you tell me, I had my teeth cleaned wherever, I'm usually very happy. Yes.
Yeah, it's better to do it than to wait.
Exactly.
Yeah.
Yes. Because I can see the awareness of this person is high and they really value their oral health. Yes.
I mean, it also aligns with the mantra of this establishment, which is your smile is our
concern. Yeah. Your smile is our concern. When you come and tell me I had my teeth cleaned 3 months ago because I was making a trip while I was in Mombasa and whatever, I'm usually very happy. We don't take offense. In fact, we commend our patients for that.
Okay.
Yes.